Bismillahirrahmanirrahim. Assalamu alaikum dear students, welcome to your channel The Anatomy Canvas, and in today's class I am going to discuss with you the model of the heart. So this is the model of the human body, and we will remove the anterior chest wall to show you the position of the heart in the body. So here you can see this is the position of the heart. It is present in the center. 1/3 of it present on the right side and 2/3 of it is present on the left side. It is directed downwards and to the left, and apex is directed to the downwards. So this was the position of the heart in the human body. Different surfaces of the heart. This surface is the anterior surface of the heart. Then this surface is diaphragmatic surface of the heart, which is in relation to the diaphragm, and this surface is the base. It is also called the base of the heart or the posterior surface of the heart. Here you can see this one is the right margin of the heart, right border of the heart, and this one is the left border of the heart, and here you can see this is the inferior border of the heart. So the main part of the anterior surface is formed by the left ventricle and partly by the right ventricle. Posteriorly, diaphragmatic surface is mainly formed by the right ventricle. So in the section you can also see this is the right side and this one is the left side. So anterior surface mainly formed by the left ventricle and partly by the right ventricle, while diaphragmatic surface is mainly formed by the right ventricle, here you can see also, and partly by the left ventricle. So this is the base of the heart, and this base of the heart is mainly formed by the atria. Here you can see the opening of the pulmonary trunk, and this main participation in base of the heart, it is formed by the left atrium, and partly base of the heart is formed by the right atrium. And in this area you can see this is the inferior vena cava, and here you can see the superior vena cava. So these are the different surfaces of the heart. Now I will show you the different sulci which are present. So first of all, this one is the coronary sulcus. This hole is the atrioventricular sulcus. This atrioventricular sulcus is found all around. You can locate it posteriorly over here, also called the coronary sulcus. And while moving on to the anterior aspect, you can see in this area it is hidden by the arch of aorta and the pulmonary trunk. So here you cannot see this sulcus. Then the next sulcus is the anterior, that is the interventricular sulcus. So here you can see this is the interventricular sulcus. In this on the underside you can also see this one is the interventricular septum. It's a muscular valve which is present between the two ventricles, and on the surface you can see the interventricular septum, interventricular sulcus over here. This interventricular sulcus goes downwards towards the apex, where it separates the apex. It separates the apex from the inferior border. You can also trace the sulcus posteriorly as well. So over here you can see this is the posterior interventricular sulcus. The interatrial sulcus is vaguely defined. It is hidden by mainly by the many blood vessels. So it is not easy to define the interatrial septum. We can easily see the atrioventricular sulcus, which is over here all around, and on anterior aspect you can see it is hidden by the pulmonary trunk and arch of aorta. And here you can see anterior interventricular septum and the posterior interventricular septum. Now I will discuss with you the different vessels which are present on the surface of the heart. So first of all, this one is the anterior, this is the left coronary trunk, and this one is the right coronary trunk. So left coronary trunk, a smaller branch which immediately divide into two main branches. This branch which is present in the anterior interventricular septum is called the left anterior descending artery. Also it is called the anterior interventricular artery. Then this left coronary artery goes around in the atrioventricular sulcus, and it becomes the circumflex artery. So this one is the right coronary artery. This right coronary artery rises from the arch of the aorta, and it runs in the atrioventricular sulcus all around in the coronary sulcus as well. So here you can see this is the larger branch of the right coronary artery, which is present in the posterior interventricular groove, and this is called the posterior interventricular artery of which is a branch of the right artery. Another artery which is present over here, which is not shown in this model, is the marginal artery, which is another branch of the right coronary artery. So another very important point over here, you can see that at this area, these are the descending branch of the right coronary artery. Also you can see the larger blood vessel which are present over here. So a T-shaped structure which is formed over here, this area is called crux of the heart. So this is another viva question as well. Then we move on to the other blood vessels which you can see over here. So this is the pulmonary trunk, this is the arch of the aorta, the right and the right atria and the left atria. Also in this direction you can see the right atria, the left atria, the right ventricle, the left ventricle, and when we will remove over here, so you can see the right atrium and the left atrium, the right ventricle and the left ventricle, and here in this area you can see the valve. Also over here, this is the valve which connects the atria to which connects the ventricle to the arch of the aorta, and here you can see the another valve which connects the right ventricle to the pulmonary trunk. So these two valves which are present over here. Then we move on to the posterior aspect, and here you can see the 4 pulmonary arteries which are present over here. Then you can see the inferior vena cava and the superior vena cava. So on posterior aspect you can see the 4 pulmonary arteries which are present over here, and then you can see this is the inferior vena cava, the superior vena cava, and here you can see the pulmonary trunk and its 2 main branches, the right and the left pulmonary vessels which are going to the lung, and this one is the arch of the aorta. So the 3 main veins which are draining the heart, the first one which is present in the anterior interventricular sulcus in relation to the left anterior descending artery, this is called the large coronary vein which is present over here. Then there are other veins, the one which is present in relation to the marginal is called the small cardiac vein, and the one which is present in relation to the posterior interventricular artery is called the middle cardiac vein. All of these veins drains into the coronary sinus. So you can say this is a large cardiac vein which is running in atrioventricular sulcus and empty into the coronary sinus. So this is the coronary sinus. Now we move on to the next model of the heart. This is another model of the heart, very beautiful model, in which you can see this one is the anterior aspect, anterior surface of the heart. Here you can see this one is the diaphragmatic surface of the heart, and the posterior surface of the heart which is formed by also called the base of the heart. Then again the different borders. So this one is the inferior border, then the right border and the left border of the heart. Then the different sulci which are present over here. So here you can see this is the atrioventricular sulcus. It goes all around in this model of the heart. You can see in at the posterior aspect also over here in this model, until over here on anterior aspect this atrioventricular sulcus is hidden by the pulmonary trunk and the arch of the aorta. So on anterior aspect over here in this area you can't appreciate the atrioventricular sulcus. Then the another sulcus which is called the interventricular sulcus. This is present between the 2 ventricles. Here is the right ventricle and here is the left ventricle. So by removing this you can see this is the interventricular septum. It's muscular wall which is present between the left and the right ventricle, and on the surface you can appreciate the interventricular septum over here. This interventricular septum goes downward till the apex of the heart, where it separates the apex of the heart from the inferior border. We can also trace this sulcus on the posterior aspect as well, and on posterior aspect you can see this sulcus is present over here. This is the posterior interventricular septum which is present over here. Then the interatrial sulcus is hidden by the large blood vessels. Again, different chambers of the heart, the right atria, the left atria, the right ventricle, the left ventricle. Now we move on to the different vessels which are present on the surface of the heart, which you are looking now. So first is the left coronary artery. This left coronary artery is a branch of the aorta. You can see, I remove just a minute. So you can see over here, this is the left coronary artery, and this is the tricuspid valve which is present over here, and in this area you can see the opening of the left coronary artery which is present. This left coronary artery, like a crown, runs in the atrioventricular sulcus and gives off a one main branch which is called the left anterior descending artery, and this left anterior descending artery is present in the anterior interventricular groove. So this is also called the anterior interventricular artery. Then in the atrioventricular sulcus, it ends and it gives the circumflex artery, also called the left circumflex artery. This left circumflex artery then supplies all of this area. Then the right coronary artery, which is another branch of the arch of the aorta, and here from the aortic trunk, you can see this is again tricuspid valve, and here you can see the opening of the right coronary artery. So this right coronary artery, at the origin, it gives a small branch to the SA node, then to the AV node. These small branches are not shown over here. Then it runs in the atrioventricular sulcus. It gives of a marginal branch, and it is also called an acute artery because of the angle which is formed over here. This is also called the marginal artery. Then this right coronary artery again running onto the posterior aspect, where it ends by forming the posterior interventricular artery. This posterior interventricular artery is present in the posterior interventricular groove. Another important point over here is that the artery which is present in the posterior ventricular artery, this posterior, when it is most of the time, this posterior interventricular artery is a branch of the right coronary artery, and in such condition it is called right dominance. In some cases, this right and the posterior interventricular artery arises from the left coronary artery. In such cases, it is called the left dominant heart, and in a very small population, this artery arises from both sides, which is called the codominance. So this is all about the arteries, the coronary arteries which are present over here. Now we move on to the veins which you can see on the surface of the heart. So first of all, on the anterior aspect, in the anterior interventricular groove, along with the left anterior descending artery, you can see a big vein, a large vein, which is called the large cardiac vein, which is present over here, and it runs along with the left circumflex artery in the atrioventricular sulcus till it reaches the coronary sinus, where it empties into the coronary sinus. On the posterior aspect, you can see the two veins, one in relation to the marginal vein, which is called the small cardiac vein, and other which is present in relation to the posterior interventricular artery. It is called the middle cardiac vein. All of these veins empty into the coronary sinus, and this coronary sinus opens into the right atrium. So this is the inner view of the right atrium. On both sides you can see the inner aspect of the right atrium as well. Now the major vessels of the heart which are present over here, you can see. First we will move on to the anterior aspect. In the anterior aspect, you can see this is the pulmonary trunk, and this pulmonary trunk, then it divides into two, the right and the left pulmonary arteries. This is the arch of the aorta, and this arch of aorta gives off three branches: the brachiocephalic artery, the the internal carotid artery, common carotid artery, and the subclavian artery. So these are the left common carotid, left subclavian, and the brachiocephalic. This is the right side. The right common carotid and the right subclavian are the branches of the brachiocephalic artery. So again, you can see again over here, this is the superior vena cava over here, which is entering into the right side of the atrium, and this one is the inferior vena cava. This superior vena cava has two tributaries, the right and the left brachiocephalic vein. Another opening over here you can appreciate also, this is the opening of the azygous vein, which is present over here. On the posterior aspect, you can see this is the this arch of aorta and then the descending aorta, and this descending aorta in relation to the esophagus and the trachea. So you can also see the relationship as well. So this is the arch of the aorta and then the descending aorta, which is present in relation to the trachea, and then the most posterior is the esophagus as well. Here you can see the four openings, two on this side and two on this side. These are the openings of the pulmonary arteries which emptying into the right side of the heart. Now we move on to the next model of the heart to see the interior aspect of the heart. So this is another model of the heart in which you can in this model of the heart you can see the internal structures, internal structures of the heart as well. So I remove this part. This is the anterior wall of the heart, which is formed by the left and the right atria over here. Here you can see the anterior here you can see the interventricular septum, which is the muscular wall of the interventricular septum, and this area is the membranous part of the interventricular septum. This is the area of the right atrium, and in this area you can appreciate over here, this is the fossa ovalis which is present over here. This one is the fossa ovalis which is present over here. In adult heart it is present as fossa ovalis, but in cases of the fetal life we see the foramen ovale over here. Here you can see the opening of the superior vena cava, and here you can see this is the atrioventricular canal over here where the tricuspid valve is present. This area is the crista terminalis which is present, and this is the anterior wall of the heart again. On this aspect also you can see the left side of the atrial chamber, and here in this you can see the opening of the four pulmonary veins over here. So these four pulmonary veins which are present over here. This is another model of the heart. You can see the anterior aspect of the heart. This is the anterior surface, the inferior surface or diaphragmatic surface, and the base of the heart. Then you can see the right and the left atria and right and the left ventricle, the pulmonary trunk, the arch of the aorta, and here you can see the pulmonary artery which are present, and the inferior and the superior vena cava which are present over here. And here you can see the four chambers which are present. This one is another model of the heart, and in this model of the heart you can see this is the anterior surface of the heart, the atrioventricular sulcus which is present over here all around except in the anterior part where it is hidden by the pulmonary trunk and arch of aorta. The right and the left atria, the right and the left ventricle. Here you can see the arch of the aorta which is present, its main branches. Here you can see the superior vena cava, the right and the left brachiocephalic vein, and the inferior vena cava, and openings of the four pulmonary arteries. So dear student, this is another very beautiful model of the heart. This is made by our very talented students, and in this model you can see this is the right atrium, the left atrium, the right ventricle, the left ventricular, the atrioventricular sulcus which is present over here. You can see this sulcus, you can appreciate it is present all around the heart, and on the anterior aspect as well you can see it is hidden by the pulmonary trunk and the arch of the aorta. This is the interatrial septum in which you can see left anterior descending artery and major cardiac vein. Here you can see the left circumflex artery. With these two are the branches, left anterior descending and left circumflex are the branches of the left coronary artery. Here you can see the right coronary artery which is present over here. This right coronary artery, then it gives a marginal branch over here which is not shown in this model, and then it gives of the posterior interventricular artery. Here you can see this is the coronary sinus which is present, the inferior vena cava which is present. Here you can see in this area the superior vena cava which is present, the arch of the aorta along with the all major vessels which arises from this arch of the aorta. So these major vessels are the brachiocephalic, the intercommon carotid and the subclavian. So these are main vessels which are arising from arch of aorta, and this is the pulmonary trunk. So this is all about the models of the heart. We will meet in the next class inshallah. Till then, Allah Hafiz.